After the birth, I found it really difficult to remember to do my insulin and my BMs the way I had done when I was pregnant, because obviously I had someone else that was demanding my attention. I was very tired in the beginning, if I'm being honest. And I think all mothers are when they have a new baby, but you know, it was great having a baby anyway. You know, you weren't really thinking about yourself after, you know, once you've had a baby, you're thinking about a baby, so I didn't really have time to, you know, to be down about it or anything.
Basically for health benefit reasons for the baby, but also the health benefits for me, and as well for losing weight and everything else is meant to be much quicker whenever you're breastfeeding. So I think there's multiple reasons behind it, but most of those come from the benefits for the baby with regards to infections.
I think it's recommended diabetics breastfeed, but I wasn't too keen on it. I preferred a bottle feed because it means then everybody else can help out, and it's just not as much of a bother. You know, I think it's easier to bottle feed, but I'm going to wait to get information from the antenatal classes and then make my decision.
I think with my first son, my mother was here and she told me that it's good for the baby and for yourself. Since I came to know that the infections and all would be avoided, mainly for that reason. Another reason personally because it's easy for me instead of sterilizing all the bottles, carrying everywhere, making a big mess. So that's the two reasons I should say.
There's no reason your experience should be any different to other mothers now, but your diabetes support team will be taking some steps to make sure you and your baby are off to a healthy start. These will include checking your baby for problems such as heart murmurs or jaundice. Your baby will also have their blood glucose level tested 2 to 4 hours after birth, and if this level is low, they might need to be put on a glucose drip. Remember, babies are usually not harmed if they have hypos. If your baby needs help controlling their blood glucose levels and is premature, unwell, or needs help with feeding, they'll be cared for in a neonatal unit. There's no reason why women with diabetes can't breastfeed and take advantage of all the consequent health benefits. For example, breastfed babies have extra protection against infections and are less likely to suffer from diabetes and obesity in later childhood. Breastfeeding has benefits for you too. It can help you lose weight and may even protect you against some cancers. However, if you take insulin, you may need to lower your dose while breastfeeding. You'll also have to watch out for hypos. Every time you feed your baby, your blood glucose will drop, so you should keep a healthy snack nearby. But don't worry, your diabetes team will be on hand to support you, helping you achieve the right balance of food and insulin requirements. Now there's another life to consider. You need to stay healthy for your baby's sake as well as your own. That means a few simple adjustments to make following your baby's birth. You won't have to make these changes on your own. Your diabetes team will be there to advise and support you. Here's the final checklist. 1. Adjust your insulin dose. After your baby is born, your insulin needs will drop dramatically, so your levels will need to be monitored regularly until they settle down. If you were taking insulin before pregnancy, you should return to the dose of insulin you were on then. 2. Return to your tablets. If your diabetes was controlled by tablets before becoming pregnant, you should be able to return to tablets soon after delivery or after stopping breastfeeding. You'll need the support of your diabetes team. 3. Make sure your contraception is in place. Remember, it's possible to conceive before your period starts again and while breastfeeding. 4. Look after yourself. Now you're dealing with a new baby and possibly sleepless nights too, it's very important that you continue to eat properly and remember to check your blood glucose. Returning to your ideal weight will help keep your blood sugar in good control, but don't rush it. Now's the time to enjoy physical activity, even if you didn't before pregnancy. Just walking with your baby is a great way to exercise. It's also very important just to find time to rest. If it's possible, you should try and sleep during the baby's sleep times. Your diabetes team will be able to advise you on a physical activity and eating plan that's suitable for you. 5. Talk to your GP or diabetes team. Like many women, you might be feeling tired or feeling down, or maybe you're anxious about not losing the weight you put on during pregnancy. Your GP can give you tests to check if this is due to an underactive thyroid gland, which is not uncommon in women with type 1 diabetes. 6. See your healthcare team 6 weeks after your baby is born. They will review this checklist with you and also keep a close check on your eyes and kidneys. Don't forget, you can still contact your diabetes team. That vital support network continues after your baby is born. Is it worth the extra work? Just listen to the following.
It's definitely been worth it. It's difficult at the start, getting used to getting into a routine, checking my blood sugars so many times a day and having lots of hypos, but I think now looking back, that was very easy in comparison, and now we've got a lovely baby girl called Bo.
During the pregnancy, I had to go to the hospital every other week, getting stabbed with needles, get my blood checked. I had sickness from start to finish, but in the end it has all been worth it. She's gorgeous and my pride and joy. Love her to bits.
My blood sugars were pretty good before I became pregnant, but certainly during the pregnancy it required a lot more work to try and test them. I was testing between 10 and 20 times at the start just to make sure that the control was good. But at the end of the day, all of that effort and all of that time is totally worth it, because both me and my daughter Alicia here are both well and happy, and that's the most important thing. And she's going to cry. You're not happy?
Well, I was always told from the first one that they only let a diabetic person go 38 weeks. The first one I was 37 and a half, because when I was up for my checkup, my blood pressure was high and I had the start of preeclampsia. But my other two, Reese was over. He was just over 38 weeks. It depends on whenever they scan you, if they think the baby's going to be really, really big, you know, it's getting out of control that way. But it was always just 38 weeks is the most you'll go.
I think I have to have a C-section because the baby gets so big, too big to fit down the birth canal due to the diabetes. But I'll be getting more information when we go up to antenatal classes, which start in a couple of weeks' time.
Your delivery is, I think, you just have less, if you have fewer options than if you were a normal woman without diabetes, because you have to have an insulin drip and you're more likely to need to be induced or things like that. So yeah, you're limited options.
By and large, labour and delivery should be no different for mothers with diabetes than for other mothers, though your baby will need to be delivered in a hospital. It's also more likely that you may need to be induced or have a caesarean section. There could be a number of reasons for this, the most common being if your baby's large. Also, your blood glucose levels will be tested every hour during labour, and as you won't be allowed to eat, you may need an insulin and glucose drip to help control your blood glucose levels. Your baby's heart rate will also be checked very regularly around the time of delivery. Women with good blood glucose control are usually delivered just before their due date, that is between 38 and 40 weeks, though your doctors may recommend delivering earlier if they believe there is any risk. If your delivery occurs before 37 weeks, you may need a steroid injection before the baby's born. This will reduce the chance of your baby developing breathing problems. You'll be looked after by the diabetes team throughout your delivery to make sure that your diabetes remains controlled and that your baby gets the best possible start.